Well, focus is still on Ondo State, but this time we're talking health. Members of the National Association of Nigerian Nurses and Midwives in Ondo State have embarked on an indefinite strike. The decision of the association was reached after an emergency meeting held in Akure. The state chairman of the association, Felix Arobode, explained that they were left with no option due to the government's refusal to address nurses' welfare. He also directed all members to embark on strike from 12 a.m. on Friday.
State Executive Council, which happens to be the highest decision-making body of NAM, National Association of Nigerian Nurses and Midwives in Ondo State, concluded that the government has been taking us for a ride and therefore resolved to direct all the nurses and midwives under the employment of Ondo State to withdraw their services indefinitely with effect from 12 a.m. of Friday, 31st January 2025, until the following demands are met by the state government. 1. Payment of the balance of January 2025 salary as agreed with the 100% new salary table. Correction of the 2022 conversion exercise, where our members were indirectly demoted, and lateral conversion must consequently be conducted for our people. Payment of the arrears of promotion and hazard allowance.
Chairman, National Association of Nigerian Nurses and Midwives, Ondo State, Felix Arobode, joins me now via Zoom from Akure. Thank you for joining us at this time. What exactly are the grievances of members of your association?
Thank you. Good evening, Nigeria. Today, the State Executive Council, can you hear me?
Yes, please, I can hear you. Go ahead.
Today, the State Executive Council of National Association of Nigerian Nurses and Midwives met to discuss the way forward. After numerous engagements with the government, we've been on this issue since 2023. Unfortunately for us, when the Congress salary structure was reviewed, it was only done for those people under Congress, that's the medical doctors. And when we met with the government, they said we did not ask. And we told them, even if we did not ask, you ought to know that health sector runs two separate salary structures, Congress and Commerce. Once you do one, you have to do the other. They said we should wait until minimum wage is approved. We waited. Minimum wage was approved in September to the sum of 73,000. When the table was finally released, we realized that it was in shambles. Nurses and other health workers under Congress salary structure were being dealt with by the state government. And after this, we met the state government, and they also realized that they made error with the table being released, in which some of the Congress 1, 2 to like 6 are earning less than the approved minimum wage. So on that, we said no to government, and we said we have to draw another table, which they agree with us. Even for us, we had to make some move to say, okay, we have to shift the grant for the government, because if we have to go by it, we ought to be requesting for the arrears since October that is the minimum wage payment started. We said no problem. We are going to start with this January, and they agree with us to pay the new table starting from January. Unfortunately, we received January salary. Even told them in one of our maybe 2 previous meetings that we prefer our salary is delayed than for you to use the bad table to pay our people's salary, which they said is as if we are threatening them. We said we are not threatening them. So we can't threaten the government. And from there.
Yes, Mr. Arobode. You know, I was going to come in. You mentioned January. Today is January 30th. January is actually yet to end. An indefinite withdrawal of services should be a last resort. The
January salary for Ondo State civil servants have been paid, and they use the...
Okay, so they use the old template. But have you considered the impact this indefinite action could have on patients who are yearning for care at this time, and maybe to consider, you know, suspending this for a while?
Thank you. Thank you so much. The issue on ground is this. For the first time in the history of Ondo State, nurses are going on strike, it has never happened like that before. And it is because we have been pushed to the wall. Aside the issue of salary, there is this issue of conversion. We've been on it for 2, 3, 4 years, where our members will be demoted, all in the name of conversion. And based on the circular release by the federal government, that's the Ministry of Staff and Employment, that lateral conversion is approved for all nurses once they are moving from diploma cadre to officers cadre. It's supposed to be lateral, but in those states, they demote our members, all because nurses are treated badly in those states. And from here, we can see nurses migrating to neighboring states, even aside the federal institution.
So at what point,
outside the country.
Mr. Obode, at what point or juncture would you consider suspending the strike?
Sincerely speaking, based on the resolution of the State Executive Council today, we were told in the last meeting we had that it has been approved. It's just remaining payments. We know that the state government will do the needful within the next few days. If they can pay the balance of the January 2025 salary, because we agreed to forfeit the arrears of the other months, no problem with that. And also pay the arrears of promotion and hazard allowance. This hazard allowance, we've been on it for almost a year.
All right.
Doctors, nurses, pharmacists, everybody in the health sector. So let the government pay the arrears, just 4-month arrears of this hazard allowance for all health workers in Ondo State. Let them pay that. Let them pay the actual money the actual salary they are supposed to pay for January, for the 2020, January 2025 salary. And if this is done, and ensure that our nurses get the normal promotion they are supposed to get.
Okay.
And again, on this issue of conversion, it must be reversed.
Okay, Mr. Obode, I'm sure you have made your point. Thank you very much. Yes, thank you very much, for sharing with us at this time. Chairman, National Association of Nigerian Nurses and Midwives, Ondo State, Felix Obode. Thank you again for your time.